Hello class, I'm Mary Kovac and I wanted to talk to you today about the measles outbreak. The Center for Disease Control estimated that nearly 100% of children ages 15 and below would become infected with the measles virus prior to the invention of the vaccine. After the introduction of the vaccine, that number dropped until the year 2000 when there were no cases and the disease was considered eliminated in the United States. Sounds like a great story, right? Unfortunately, that wasn't the end. So what exactly is the measles virus? The first time in history that we see the symptoms of the measles virus being described is in the 9th century by a Persian doctor. In the year 1912, the United States required mandatory reporting of all diagnosed cases of the measles virus. In the 10 years after mandatory reporting began, the U.S. saw an average of 6,000 deaths each year just due to the measles virus. Measles virus starts to get symptoms 7 to 14 days after transmission. The American Academy of Pediatrics describes the first symptoms of being flu-like, just kind of like every other illness. It starts with a fever, a cough, and a runny nose, but 2 to 3 days after that, victims then get what are called Koplik spots. And these are little white dots that appear inside your mouth. Another 3 to 4 days after that is when the measles rash starts. That is the flat, red, splotchy rash that appears all over a victim's body that most people now think of when they think the measles virus. Also, in more severe cases, the person can then develop pneumonia or encephalitis, which is a swelling of the brain. From there, in the most severe cases, it can cause death. So, how did we get rid of it? The main reason was a vaccine that was created in 1968. The vaccine was so effective that it's actually the same vaccine that we still use today. Now we call it the MMR vaccine. It eliminates both measles, mumps, and rubella. It is given twice at between 12 and 15 months old, and again at 4 to 6 years of age. It is considered 93% effective after the first dose, but they recommend the second dose to bring it up to 97% effective. Now, efficacy can start to fade after a few years, and they recommend having blood titers done as an adult to make sure that you still have that protection. Or if not, you can get another vaccine as an adult. So why is it making a comeback now? One main reason is there are lower rates of vaccinations, and this is for a few reasons. Some people don't believe in vaccines. Some people aren't able to get vaccines for medical reasons. Some people just aren't old enough to get them yet. But the biggest areas that we see making a comeback are areas that have a higher percentage of unvaccinated people. In 2017, one town in Minnesota had 75 confirmed cases. The CDC was able to determine that they had a very low rate of immunizations in that area. Then also are things like religious beliefs. Some sects of Amish don't believe in getting vaccinated. 383 cases were found in one Amish community in Ohio in the year 2014. Another reason is people that travel out of the United States into areas that have higher rates of unvaccinated people or just higher rates of measles cases. In 2018, 82 of the cases confirmed in the U.S. are believed to have been brought back to the United States from people traveling. So what can we do about the epidemic now? I would suggest speaking with your doctor. Determine what's right for you and what is right for your family. Consider the vaccinations, but also consider the side effects and symptoms. Do what is best for your family. Thank you for listening to my speech.